Good afternoon, everyone. My name is Dena Barnwell. I am a doctoral student at Morgan State University and also a research assistant at the Center for Maternal and Family Health. And I'm very excited to be given the opportunity to present the findings from my dissertation research study. Before I proceed, can somebody just confirm you can see my screen? I just want to make sure.
Yes, Dina, we can see it.
Perfect. Thank you so much. Okay, so I'm presenting my dissertation research on the stories of Baltimore fathers. So this was a qualitative study on the motivations and challenges of involved fathers. I'm not just a bit about me. I am from Baltimore, specifically over West. If you know, you know. I'm also a daughter and a certified health education specialist and certified community health worker, and was really excited to be sharing this research with everyone. So I'll talk about a little bit about the background of what we know from previous fatherhood research, a bit about my study design, and then I'll just share my results and a bit of a discussion about those results. So, for the background, the society has undergone many shifts in family structures in the past century, which has seen fathers become more engaged in the caregiving activities for children. Modern dads see being a father as a core part of their identity, and more dads than ever are choosing to be stay at home parents. So, whereas in the past, stay at home dads may have been due to reasons might have been cited that it was due to disability or inability to work, now it's starting to be more of a choice to participate in those caregiving activities. But despite the growth in engagement, father inclusive interventions and paternal mental health supports have not kept pace. Additionally, there is room for growth in the fatherhood space. So, about 20% of fathers have little to no involvement with their minor children, and almost 25% of children have no father in the home. Non-white fathers and those without higher education are more likely to be non-residential. And in general, non-residential dads are less engaged than those fathers who live with their children. These data, they present a picture of paternal absenteeism and illustrates a greater need to focus on paternal support. Now, over time, the concept of fatherhood has evolved from being primarily based in financial support. Almost 60% of Americans feel that beyond financial roles, fathers should provide emotional support and pass on values to their children. A 2023 research study indicated that fathers provide about one-third of children's daily care, and almost all residential fathers report being engaged. And of non-residential fathers, Black fathers are the most likely to remain engaged, even when they are not living with the child and they are no longer with the child's other parent. But despite this evolution, fathers still battle unfavorable stereotypes due to this longstanding notion of fathers as financial providers. Those who are unable to do so are often called bad dads. And looking at the deadbeat label, it appears to have risen in the culture due to this night. It was a 1986 CBS report that followed some Newark, New Jersey parents. And in this report, there was a man who bragged about having six children that he doesn't take care of because their moms get money from the government. And then the culture kind of just took that one documentary and ran with it. More broadly, fathers of all socioeconomic positions are painted as inept. So if you think Al Bundy or other fathers from sitcoms or movies who are portrayed as not being able to adequately care for children themselves without some sort of direct guidance or intervention from mothers. And when fathers are involved, everyone benefits. So children are healthier, they fare better academically, and are less likely to exhibit behavior problems. And even moms benefit. So the presence of fathers is associated with fewer depression symptoms in mothers and better utilization of healthcare services. Fathers themselves have greater self-esteem and lower instances of substance abuse. The research points to some barriers to involvement, including poor co-parenting relationships, non-engagement during pregnancy, and maternal gatekeeping, which is when mothers use their power to determine how and when fathers can engage their children. Now, men can also be vulnerable to perinatal mental health issues like depression and anxiety. So, on average, about 10% of fathers experience postnatal depression, but that rate can be as high as 25% in fathers whose partners have postpartum depression. And depression can present a little differently in men, but the impacts of poor paternal health are far reaching. One research study, this quote comes from a 2015 research study, and it leads into life course theory. And since the transition to parenthood can be considered a developmental crisis period, any experience occurring during this time can have lasting impact on fathers and families. Therefore, it is important to provide support. And to support fathers, some evidence programs like the one hosted in Baltimore by the Center for Urban Families have been developed. Participation in evidence-based interventions have led to positive outcomes, but these programs, they often experience high attrition rates, some over 50%, even when incentives are used. On the policy level, fathers can have difficulty navigating the separate child support and child access systems. Fathers can have child support payments levied against them based on potential earnings, even if they are jobless at the time of the order. Policies like these can lead to a loss of license, employment, increased debt, and all those things can further impact involvement. And so the purpose of the phenomenology study I conducted was to explore the experiences of involved Baltimore fathers, with experiences meaning their motivations for involvement, challenges to involvement, and resources that they would like to have available. Now, there were some gaps in the literature this study sought to fill. Most of the current research has not included diverse populations. One 2024 mapping review about paternal mental health reported an overrepresentation of white, mid to high income fathers, and those studies that did mention non-white fathers, there were deficit-based assumptions about them. So the previous studies, they were looking for what's wrong, what are the risks, why are the fathers not there? But this study focused on what are the motivations of the fathers who are there, how can we better support that? Additional studies cite the incidence and or prevalence of issues related to fathers, but there's a need for more context. And so my two research questions were, what factors impact adult Baltimore fathers as it relates to their involvement with their children, and how do involved fathers in Baltimore experience fatherhood and its challenges? So for an overview of the methods, this study was designed based on a qualitative phenomenology approach because of its ability to elucidate context and dive deeply into the experiences of the participants. Compassionate, community-focused research is a method by which researchers have a vigorous interest in the human condition. And this part is very important here, places a high importance on presenting the narrative back to the focal community in a way they would both understand and agree with. And then community engaged research includes participants as partners, not subjects, and incorporates their insights into the research methods. I used focus groups to collect data rather than like interviews or surveys to create an environment where participants could build lasting connections if they chose. So if I used one-on-one interviews, they would just be talking to me. But in the focus group kind of setting, they were in a space with other fathers and had the opportunity to create those lasting connections and stay in touch if they desired. Focus groups also allow participants to be more candid with their responses and build on each other's thoughts. And so that provides data rich with context and meaning. And then finally, there was a storytelling component added because it shows a commitment to going beyond the surface to explore the depths of social phenomena. I went through IRB approval, and that was received in December of 2024. In January, I recruited men from Baltimore with experience gauging fathers to facilitate the discussion. So these were father-only spaces. It was the facilitator. One facilitator runs a nonprofit in Maryland called Winning Strategies that helps fathers navigate child access issues, and another facilitator is a local deacon. Laura Wexler of the Stoop Storytelling series worked with the facilitators to develop story building skills that we use to support the participants. And I created a facilitator guide based on resources from the University of Kansas's community toolbox that the facilitators could use to help guide the session. For recruitments, I used propulsive snowball sampling. Now, initially, the recruitment, as you can see in this flyer here, was for 18 to 40-year-old involved Baltimore fathers who made a maximum of $66,300 a year. Income was included because prior research has been focused on individuals with higher income. And involved was defined as a father who regularly interacts with their child, provides emotional support, and or participates in the child's development and raising. But as the recruitment commenced, the fathers expressed a concern with that income criteria. They said that the income limit was not helpful as a hard delineator because income looks very differently based on the amount of children you have. So somebody have with one child making 66,000 might have the same experience as somebody making 500,000 but has 7 children. And so they challenged me to look beyond that hard income delineator and look at their experiences of fatherhood. Additionally, some fathers brought other fathers with them who had not been kind of pre-screened. And I didn't want to turn anyone away that had come all that way and they were sharing their input. And this is community engaged research. And so the decision was made to include all the fathers who showed up to the session, as long as they provided their informed consent to participate. And then as I'm analyzing the data, I could compare results and see if there were any differences based on income or age or any of those factors. And so this compassionate community engaged approach honors the participants as the fatherhood expert and allowed me to adjust based on their feedback. And so the final set of participants included 27 Baltimore fathers, age range from 31 to 62. 44% had achieved a high school diploma as their highest level of education. 26% had gone to a trade school or had an AA degree, and 30% had earned a bachelor's degree or higher. And all the participants but 5 lived with at least some of their children. Now, for the first part, participants were invited to attend a 2-part session for this study. There were 6 in total. 2 were at Conscious Heads Barbershop on 25th Street. 3 were at Greenmount West Community Center, and 1 was located at Supreme Fitness. Food was provided at all the sessions. Haircuts were offered at the barbershop locations, and participants had the option to kind of work out during the conversation that occurred at Supreme Fitness. In the first part of the session, I reviewed the consent forms and the participants selected a name. That if they didn't want to use their name, if they wanted to protect their identity, they could select like a nickname to use. And then I left the space and the male facilitators guided these group discussions where the 10 questions on this slide were posed. This part was audio recorded and transcribed. Many of the questions came from prior research. However, I did get some from a Navigating Fatherhood plenary session at the 2024 National Fatherhood Summit in Atlanta. The host of that session, Mr. Patrick J. Patterson, provided permission to use some of those questions in this study. After 90 minutes of that focus group discussion, I rejoined the session for a story building activity. So during this time, participants used storyboards like the one showed here to develop a 3 to 5 minute story about a time they felt like they were winning at fatherhood. And so the fathers took a copy of these study storyboards to practice for the community storytelling event that would occur after data collection. See? After data collection, all the participants and the community were invited to the Baltimore Unity Hall for a storytelling event. It was hosted by local comedian Poppy the Bear. World-renowned K Love the Poet did a set of 3 poems that she had wrote based on her fatherhood experience. This event was recorded, and each father's story is who presented at this event is being edited to be released online in a social media campaign called the Stories of Baltimore Fathers. It is the goal for these kinds of sessions to continue. But here is a short recap of that event. And I'm really hoping the audio works.
It's actually missing a piece to its puzzle.
Gotcha.
Now, throughout the book, though, you find out that the actual piece that he's talking about is the incarcerated father.
I asked her, what do you think my role is as a father? And the first thing that she said to me was protecting.
I went up against another judge on Zoom. He says I'm turning the mic off. I said I'm turning it back on.
Is that as parents, and certainly as fathers, since we're focusing on that, we are still figuring out our lives while we're trying to help other lives figure out theirs.
Absolutely. I stopped trying to control and started trying to connect. And slowly things change, not just in me, but in them.
So that was a really short recap. There's more clips being released, but it was a really touching event. Now to talk about the result. So for the data analysis, did I skip ahead? Yes, for the data analysis, I use Bingham's 5-step qualitative analysis process. And so it is used to execute transparent and systematic qualitative data analysis. And so I used NVivo as the software, and also did some manual editing. I had to go through the transcripts to make sure that what the transcripts had matched what the individuals actually said. Sometimes those transcribing software have issues with accents. And so I had to do some repairs, but then after that, I used NVivo to analyze and find themes, and then apply that through my theoretical framework that I'll share later. And so after the analysis, 3 main themes that influenced the motivation of the participants were identified. So the first was passing on legacies. There's this desire to share their values and the things that fathers have learned to create better experiences for their children. The participants saw the quality of their lives and the quality of their children's lives as part of their legacy. For some fathers, the desire to pass on a positive legacy was a catalyst for them changing some of their own behaviors. They wondered what stories would be told about them after they've died, what their children would say about them after they're no longer here. And the fathers expressed that the only way this can be accomplished is through presence and modeling. Now, sometimes the kind of legacy varied based on the gender of the child because dads feel more directly connected to the experiences of their sons. They often saw their sons being an opportunity for them to kind of redo some things that they wish they had done differently. For example, in this quote here by one of the participants who said that it was just like an opportunity, like, wow, I got a son, I can make a better version of myself. Legacy was a word that was often repeated. It's a part of a shared fatherhood vocabulary and represents an important motivation to be involved in their children's lives. Fathers want to be remembered and they want their impact to span generations, and this requires presence. Some fathers even shared that when their children allow them to be in the presence of their grandchildren, then that lets them know they did a good job, that their children still want to be around them even when they no longer have to be. Another motivating factor comes from, related to that, another motivating factor comes from the children themselves. So based on the data, children play an important role in motivating paternal involvement. When children share verbal appreciation or pride in their father, it encourages the father to continue to be involved. Even when appreciation is not expressed as direct words of affirmation, fathers are motivated when a child reaches out to them for advice, or even when a toddler motions to their dad to be picked up. Daughters in particular have often inspired dads to redefine their definitions of masculinity and learn how to engage their daughters in new ways. One example of this kind of positive reinforcement from children is illustrated in this quote here, where it actually the child helped influence the father's esteem about his own job, where he said, I'm a trash man for the city. My sons love when they see a trash truck. Like, that's my father's truck. And it's not the best job. I want to do better, but they thinking that's the best job because my father is doing it. And so children play a major part in the experience they get with their dads as well. The third theme was the motivation to create countertypes. So fathers in this study understand there are many stereotypes surrounding fathers who look like them. They express the common narrative of the deadbeat dads who are not in the lives of their children, or those who reluctantly pay child support but do nothing more. One participant stated that the Baltimore motto is that the father's not going to be there. These dads take on the weight of changing these unfavorable narratives. The fathers also express the importance of dealing with their own trauma so they can be better versions of themselves for their children. Many are intentionally being softer with their children, allowing them to speak up and avoid corporal punishment. Again, the fathers have shared the importance of being present. And that's this quote here. I've got 3 kids, so there's a lot of different meanings to fatherhood because I have to be a different person in a different way with everybody because everybody's got a different feeling. And so this father is describing the process of literally co-creating fatherhood and making it different than what he experienced or what he had seen in the past. Now, there were some challenges expressed to being involved. The fathers experienced 2 main challenges. The first was the impact of fractured relationships. When relationships end, there is often discord between parents that impacts paternal mental health and father's ability to be present with their children. The father shared sometimes children are withheld intentionally as a tool to hurt them, and sometimes the legal system is weaponized to punish them. The fathers also feel that sometimes the mother can imprint their hurt feelings and anger onto the child, resulting in the child taking on those same feelings, creating distance between the father and the child. Additionally, it can be difficult to manage the transition of children between 2 homes with potentially different values and parenting styles. These feelings of powerlessness in family matters continue to emerge throughout these discussions. Many had stories of family court being wielded as a tool for control, and this has led to resentment and distrust of women and the legal system, which harms their involvement efforts. As with in this quote here at the end of the day, because the child is around the mother a lot, they start taking on her philosophy and the way she's thinking about it. More so, if I see it, then my father come around and be like, yeah, he's sorry. Yeah, I'm looking at him and I say, you could have paid that money. So what the fathers were expressing here, many of them were taking accountability for any part they played in the breakup of the relationship, but they were stressing that that doesn't make them bad fathers and they're looking to maintain their relationships with their fathers, but sometimes the hurt that comes with fractured relationships can get in the way of them maintaining the types of relationships they would like to have with their children. And the second challenge concerned the emotional and mental health of dads. So we talked earlier about how mental health can influence involvement. Fathers express various fatherhood related fears and worries related to their roles. So many fathers worry about injury, job loss, or some other factor that could prevent them from being able to financially support their child. They also express discomfort with the type of lessons they feel they need to teach their children to navigate in a tough world. Most importantly, the fathers were worried about what happens with their children in their absence and whether there will be unhealthy influences. Now, these absences could be due to relocation, in some cases, incarceration or military service or some other activity. Here, one of the participants described this in his own words.
The most thing I can say I was worried about, because I probably cried on literally 10 of my close friends' shoulder about this before I went to jail and while I was in jail, is that my daughter wasn't going to love me. That her mother or somebody's going to he wasn't gonna love him. And I really can remember crying on at least 10 people's shoulders and men hugging me and sitting me down and saying, bro, your daughter gonna remember who you is.
And so that is one participant sharing his fear and worry about if his daughter would still love him, or if somebody would kind of influence how his daughter feels about him. Now, at the societal level, fathers also face poor narratives and family court policies that seem to give mothers more power, limiting paternal autonomy. Additionally, fathers in this study, they stated this desire to directly manage conflict, but the perceived imbalance of power that leans towards mothers in matters concerning children forces them to adopt avoidance coping behaviors. And so while this can reduce active conflict and help them maintain access to their children, it can result in poor mental health and overall well-being. Role expectations were also prominent as some fathers expressed discontent with their role being reduced to child support payment. What's most important, because this is a strengths-based or asset-based study, is that the fathers have maintained a fierce determination to remain involved despite any of the challenges that were missed or that were discussed. Now, I also asked the fathers about resources that they wish were available. The participants want to understand their paternal rights so they can navigate the times that they are forced to be in the system. Forced was put intentionally because many fathers do feel like they are forced into the system where they want to kind of just work things out between the parents. Fathers also expressed a desire for daycare voucher support so they can maintain their employment during the weekends or other times they have their children. They also indicated that the eligibility for many support services can often be very restrictive. Many fathers fall just outside the income level to qualify for benefits, but still struggle to meet the needs of their family. There was also an expressed need for more discussion spaces, like the one that they were part of for this study. Spaces where they can be vulnerable, create connections, and talk about important parenting topics. The father shared that just creating these spaces for these conversations where fathers can talk without judgment was healing for them. There were participants who shared, I had never stopped another man and asked him these questions. As the quote that's on this slide, some of the fathers were finding comfort in knowing that other men are experiencing the same things. They used to think it was weak to talk about, open up and talk about certain things, about their feelings. But then in conversations and spaces like this, they were able to understand that, as in this person's word, everybody goes through what we go through. So now what? There are many steps that the public health community can take to support fathers and their involvement efforts. Public health professionals can emphasize motivating factors like legacy and marketing campaigns to reach fathers. I know in Baltimore, one time I was riding down Greenmount and I saw there was a big billboard about child support and it was a sheriff on there and it was like, pay your child support. And I know that we sometimes like to lean into what will happen if you don't do something. However, perhaps we can lean into motivating factors like legacy when we are attempting to reach fathers and encourage involvement. We can work with child-focused spaces like daycares and early education centers to teach children skills to communicate positively with fathers and show gratitude. So this is a skill set that we can help teach children. We can also support schools, courts, and other organizations with promoting balanced narratives about fathers and send messages that reinforce the importance of fathers and our willingness to meet their needs. As a side note, while I was working on the Stories of Baltimore Fathers, the social media campaign, I tried to create a logo to use with this for the campaign. And I used an image generator and I typed in, hey, I'm doing this research study about stories of Baltimore fathers. And I would like a logo that I can use for the stories. And one of the image generators gave me an image that says stories of bad Baltimore dads. I was like, where did bad come from? I didn't say anything about bad, but these balanced narratives, making sure that even when we go into the AI space and we talk about fathers and then we mention Baltimore, there's an assumption that it's bad. And so working with all these organizations, the public health community, the culture as a whole to promote positive and balanced narratives about fathers and send messages that reinforce the importance of fathers and our willingness as public health professionals to meet their needs. The public health field could also do more to support marriages, cohabitating families, and non-residential co-parents. For example, parents navigating custody and access issues are often required to take parenting classes, but associating parenting classes with court proceedings could send a subconscious message that parents who take parenting classes are deficient in some way. So making parenting classes more widely available can help parents see that these skills can be helpful for everyone. Child support and child access policies should be reviewed for equity, fairness, and application. And we can advocate for policymakers to assess if the current system provides any unnecessary barriers to paternal involvement. For example, the participants felt the fragmented nature of the family court system reinforces collective beliefs that neglect the non-financial contributions of fathers. And there could be an exploration of the policies that appear to lean towards mothers when deciding family matters, and fathers should be included in these efforts. Psychometric professionals could develop instruments to assess the mental health needs of fathers that have wording related to fatherhood and include the ways mental health issues can present in men. But there should also be asset-based instruments related to fathers. So much of the fatherhood research is from a deficit-based lens, which reinforces mindset that only looks for what needs to be fixed in men. This inclination often extends into public health practice as we focus on uncovering the problems of a person, population, or group. But asset-based approaches seek to identify the strengths and protective factors that could lead to improved outcomes. And then finally, peer-led models, conversation models should be explored as interventions to support paternal mental health and involvement. The participants expressed a desire for more spaces like the one in this study to be made available to them. Now, during the process of conducting research, there were some important and serendipitous events that caused me as an individual to reflect and to grow. Prior to the start of the recruitment, I reached out to some father-led grassroots organizations and found that some of the people in the space were suspicious of research efforts. At one community event, a man asked, "What is Morgan's plan for the community?" After I introduced myself as a student with another grassroots organization, I was immediately replied with all of this information, saying that the demographics have changing. It's not what you all think. And so there is an impression that any research is going to be looking from a deficit-based lens. These kinds of responses reinforce the need for researchers and public health professionals to earn and nurture the trust of the communities that we serve. Another area of interest was in the participant eligibility criteria. So I discussed that, how I included income initially, but the fathers pushed back on that. And so listening to the community is a vital part of the process. And I'm really happy that the qualitative methods used allowed me to adjust and listen and act on that feedback. Additionally, this study included fathers who were all of minority backgrounds, even though none of my recruitment materials mentioned that. One contributor could have been the snowball method of recruitment. So people were telling other people they knew about the study. I also wondered if my race could have been an influence where people were thinking, I'm a Black woman, I'm focused only on the experiences of Black men, which is it was just a reflection of the research process. Another personal note is I had to manage my emotions while reviewing the recordings. Some of the conversations triggered difficult feelings in me. Now, based on the principles of trustworthiness for qualitative studies, I kept a reflective journal of these responses, and I used member checking that I'll talk a little bit about later to make sure that my interpretations weren't influenced by this. The decision to employ male facilitators, initially it was done to create a welcome space for the participants. However, having physical distance from the discussion also ended up being very important for me as a researcher. And then the way that the focus group were conducted turned out to be more beneficial than originally planned. The participants found the space to be healing. They were exchanging numbers at the end, promising to stay in contact with one another. And so when conducting research studies, researchers may consider including components that could impact the community immediately. So sometimes when we do informed consent, we say what the benefits are and what the, risks are. And sometimes if we don't have an incentive, we'll say potentially, there is no benefit or the benefit is in you contributing to a body of knowledge. However, when we're going into communities, is there a way that we can provide some benefit through the study design that could continue to impact the community even after the data collection ends? A note on trustworthiness. So a major component of qualitative research is trustworthiness. This is key to ensuring the reliability and validity of these studies. This table highlights the strategies I used. One of the most important steps to me was to use member checking, which invited the participants to review and critique the results. So after I did the analysis and I wrote up the results, before I presented them to anyone, like including my committee, I sent them to the participants and facilitators for their review and comment to ensure that it accurately reflected what they were saying, that I did not misrepresent anything that was shared. And that was very important because I realized that I am not a father and I've never been one. I am interpreting the information that I'm hearing, and I wanted to make sure that I was interpreting correctly and not, putting my own biases or any other experiences into the results. There were a few strengths and limitations of this study. For the strengths, the study's research design allowed for a collection of rich data about the participants' experiences. Male facilitators guided the session, which encouraged participants to share their experiences. And the in-person focus group format allowed the facilitators to probe and ensure that there was an accurate capture of the participants' experiences. And then the storytelling allowed fathers to share their own stories firsthand. Another strength is that the study focused on the factors that influence motivation and involvement. So many studies measure involvement by assessing participation in particular activities, but this study sought to uncover the factors that motivate fathers who are involved. There were several limitations. So the participant stories were not verified by third parties. All participants were of non-white, and so but they were all either African American and one identified as Arab. So these themes might not be generalizable to other groups. Additionally, I was not in the discussion space, so that prevented me from observing certain nonverbal communications. However, I did debrief with the facilitators after every session, and they helped me identify things that I might not have been able to see personally. And then as we talk about the future research should test fatherhood group discussions as an intervention to support paternal mental health, which I know I just had the opportunity to work on a research study with Dr. Fakunle at Morgan. And so these studies are coming. Paternal mental health instruments that uncover the assets and challenges of fathers should be explored, and the exploration of maternal gatekeeping to uncover any patterns of behaviors and potential impact of that phenomenon. So in conclusion, paternal involvement is vital to the health and well-being of families. Many fathers have a desire to be involved, but face barriers. This qualitative study explored the stories of Baltimore fathers to understand their motivations, the challenges they face, and the resources that could be used to support them. Despite the racial homogeneity of the participants, the study uncovered several themes that could influence interventions and policy efforts to support paternal involvement. In future studies testing public health messaging, mental health instruments, and intervention activities could lead to an improved climate for fathers. And so as I was going through this, there's like a lot of people to thank for this. First, to the participants, the facilitators and fathers everywhere, you are equally valuable parents and you matter. My committee, Dr. Edwards, my chair, Dr. Fakunle, Dr. Kinlock, and Mr. Chris White. And then the next section are the people who participated in support, from the facilitators to Dr. Butler, who helped me with recruitment, Dr. Baptiste Roberts with connections, and Miss Carol Ann Hendricks, sorry for the wrong pronoun there. John Noss, I had Jabari Nator is from Conscious Head Barbershop. I would like to recognize him, especially for allowing us to use his space for these sessions. Supreme Fitness, Poppy the Bear, who was the host, DJ Slick Vic was our DJ at the event at the Baltimore Unity Hall. Charm City Bipper did the videography. Joey Dukes, who's also a Morgan alum, provided the catering. And Dr. Latrice Rollins, Dr. Lemons, and Dr. Murray provided me with some of my first research experiences. And then I also thank my family and my cohort members, Bianca, Brian, Marquise, Amber, Tyree, Monique, Felicia, Natasha, and Mia. But are there any questions for me?
Thank you so much, Enid Zaire. I was able to pop in. Sorry for being late in the beginning, but thank you for a wonderful presentation and allowing us to be your second speech about your dissertation, and showing us another side of what maternal health is and how we can continue to support maternal health by way of fathers and the whole family unit. And so I just want to thank you again, and thank you everyone for being on the call today. And at this time, we'll open it up for question and answers. So we will allow you to use the Q&A box. If you have access to the chat box, I'll be monitoring both. And we will just hear from the audience now. Thank you again, Dena. So we'll monitor it while some questions populate in.
And as they're coming in, I did want to share that the stories are starting to go up online. And so if you're interested in seeing them as they come out, they're on Instagram page, or you could just email me or LinkedIn me and I will send you the link.
So we have one first question for you, Dena. So the question reads, can you expand more on the community statement on researchers only viewing the issues/problems as a deficit?
Yes, thank you for that question. I think there have been research studies where, and this comes from, I reached out to a very important grassroots organization here to kind of make a connection before I went out in the community. And the initial response was, hey, we are here. Like, before I could even explain, there was this need to share. We are here. The demographics are changing. There's starting to be more single fathers, and single mothers are going down. There was this impression that the research was going to be focused on that, because that has been how they have seen themselves portrayed in previous research studies. I did have other experiences within the community where there was expressions of how organizations, researchers come in and they do this, whatever they're doing, and they take their pictures and they get their metrics, and then they're ghosts, and the community never hears from them, never see them again. And then they just present the results without their input. They never hear back. And oftentimes those results are not very favorable. And so I've heard that throughout my interactions with the recruitment and trying to make those connections even before I recruited. But some of that also came out of my research. So as I was doing kind of my literature review to understand what has already been shared, a lot of the studies that I came across were about risk factors or why fathers are absent. There was a study done with the Baltimore Sun where they mapped out how much child support is due by neighborhood and zip code in Baltimore. And so that has been the focus a lot when it comes to fatherhood studies.
Thank you, Dina. I see we have another. Let me see if there's another question that popped in. Okay, it's just the same one. But as we allow more questions to come in, I did have a question for you regarding the fathers that you were able to interview in your focus groups. Did they have any kind of historical context or background about how these kind of stereotypes and quotes came about around the deadbeat dad? Like you mentioned, the clip of the film where the man talked about having six children and not wanting to take care and support them. Were there any consensus around, how these things or stereotypes kind of came about, or just fathers were kind of, just in the dark around the historical laying of those stereotypes?
I will say I am not sure. Within the context of these conversations, the fathers would share awareness of these stereotypes, but there was no probing into where they think the questions came from. I think that could be a very important topic for future research, to see if there's that understanding. I do know many of the fathers share their own experiences and how those may or may not have gone well, and how that kind of really influenced. One of the fathers did say that it's just the Baltimore motto. So to him, it's everywhere in the community where he hears it, and it made him decide, I'm going to be at everything. Like he said, he was at every single one of his children's births. He was at the hospital because he didn't want to miss anything, because he had heard it so much just growing up and just being out in the community.
Thank you. We have two questions that have populated, so I'll read the first one. I was wondering how you think the absence of a third party to corroborate the father's stories may have influenced your research findings. I'm not suggesting that the fathers were being dishonest, but it's possible that intentionally or unintentionally, some details could have been exaggerated or framed in a certain way. How did you take that possibility into consideration when analyzing and interpreting the data?
Yeah, so I noted it as a limitation, but other than that, I just went with the stories I was told. I went into it saying like, hey, this is the stories of Baltimore fathers. And if this is their experience, then that's what I'm highlighting and that's what I'm analyzing. I will say that I was actually really excited to do it this way because a lot of previous research has analyzed fathers based on the insights of people who are not fathers. There are even some psychometrics, some instruments that measure mental health, that measure paternal mental health, but it's filled out by the mother. It's like a partner form, where they are giving insights that then are being used to assess the mental health of fathers. A lot of the other research studies were based on stories of others, and then we're kind of summarizing the experience. So in this space, fathers were sharing their own stories. I was summarizing their own experiences, recognizing that there could be different, even if they weren't being dishonest, sometimes we just see things differently, when we're on different sides of an issue. But I think it's really important for this study to highlight the paternal perspective and see how we can lean into that and really support that.
Thank you, Dina. The next question. For next steps of your research, do you envision a focus on the income range being higher or focusing on its connection with the number of children they have?
So I think that's a really, really great question. Um, I actually did not consider even continuing along the lines of income for this type of research. For this study, after income was removed, we had a huge variance, of experiences, and it did not change based on whether somebody was making over six figures or not. Um, I do think research, income is, I would like to kind of analyze data to break down to see if income is an influence on certain outcomes. However, I don't perceive using income as an eligibility criteria. I think for the research, that I envision, it's more about the getting involved? What are the assets of certain groups? How can we promote involvement? But that's a great question, and I would definitely do some more thinking on that to give a better response. But just off the top of my head, I'm really hoping to see more research focus on what the assets are, and then potentially break that down by income to see if different supports would be used, but not to make it where you have to be this income to participate in this study.
Thank you, Dena. And the person that asked the question added another comment that said, mainly as they're saying the demographics are changing. So in connection to that, were looking to explore the focus on income ranges?
Hmm.
Mm.
To give some thought to that. Thank you. Thank you for adding that note as well. That gave me some more context.
Perfect. Okay, so we're waiting to see if anybody has any more questions. Let's see. Oh, someone said great work. I don't know if you can see it, but
Well,
yes.
thank you. And I really appreciate the fathers for being willing to share their story. I think many of the fathers were saying, I'm just happy somebody cared enough to ask these questions. And that hit home because that let me know many fathers feel unheard. And that connects with a lot of the previous research that says that sometimes fathers feel like accessory parents, that they are not as important or they're not as valuable. And so to create these spaces where I think before we can get too far along, we have to create more spaces to listen, give fathers a chance to share, and then figure out next steps, what those next steps look like.
I agree. Thank you, Dina. So we have about 6 to 7 more minutes left of our conversation today. So I'll just keep the floor open for a few more minutes to see if any other questions roll in. But if there's anything else you want to share with us, Dina, please feel free to while we wait for any more questions to come in. And if not, that's okay too.
I will say if there's anyone on the call and are really looking to um, support anyone doing fatherhood work, there are a lot of amazing grassroots father organizations that are led by fathers. They're out here doing the work, often out of their own pockets. They're not getting big grants and they're not getting funding. And whenever there's an opportunity to recognize them or invite them into spaces, please do so. We have like Dad's United organization, there's the Black Daddy Gang. There are many groups who are out here. There was an annual Father's Day in the Hood basketball tournament. And so really recognizing that fathers themselves already are looking to make these changes, become more involved and change narratives. And so they're not looking to be fixed. They're already doing the work. And so what ways can we support and elevate the work that they're already doing? And thank you for this opportunity.
No, thank you. We wanted to make sure that you were the first person to open this year's speaker series, being that you successfully defended your your dissertation, and that we wanted to be able to bring your knowledge and your wisdom to a wider audience. And we felt that there was no better place to do it than the Center of Maternal and Family Health. So thank you, Dina. And I don't see any other questions in the chat, so I think we are okay to begin to wrap up. And so I want to thank the audience again for being a part of the discussion today, and lending us your ears and your time. And we also want to invite you back again next month to join our speaker series, where we'll have another amazing conversation centered on maternal and family health. And we hope that you all have a wonderful day. Thank you again, Dina, for your amazing work and your presentation. And so we thank you all for coming, and have a wonderful rest of your day and weekend.